Welcome, everyone. Welcome to the Skoll Awards Spotlight Sessions. My name is Ben Pine. I'm a principal at the Skoll Foundation. It's great to have you all here in the audience. We're just coming from the award ceremony where we introduced the 2022 Skoll Awardees. And in this session, we have the huge privilege of speaking in more depth with Noora Health for the first 30 minutes of this session, and then MapBiomas for the second 30 minutes. And this is really just an opportunity to dive a bit deeper and learn more and be live with our amazing 2022 Skoll Awardees. Excited to dive into that, but have some housekeeping things first. For those in the audience that may have missed the award ceremony, it will be available on the Skoll website, on YouTube, social media, etc. Please take an opportunity to share on social media using the hashtag SkollWF. And just know that this session is being recorded as well. And if you need translation, you can access translation options in the translations tab to the right of the video window. And then lastly, audience members, we would love to hear from you in terms of what questions you have for Noora and for MapBiomas in this session. So please share questions that you have in the chat, or comments, or love, or support, and we'll try to work them into the conversation. But it's our huge privilege today to have some time with Noora Health and its co-CEOs, Edith and Shahed. Edith and Shahed, welcome and congratulations on the Skoll Award.
Thank you.
Thank you, Ben.
How are you feeling?
We keep saying this, we're pinching ourselves. It's surreal. We're just so honored. It's been a long time in the making, I know, and feel so privileged to be sitting here. We're very humbled.
We're really grateful for your work and so glad to have this opportunity to dive in more. And I was really struck by the words of Archbishop Desmond Tutu in the video that I think his quote was, "We are made for caring." And I thought that probably struck you and your team as well, and just so important to your mission. And I just want to kick off with a question. I think that another thing that Desmond Tutu said in that video was he talked about joy amidst the hard work. And in this work, your work is extremely hard, especially these last couple of years. The work of caregivers is difficult. And I would love to kick off by learning a little bit more about you two and kind of which parts of the work really fuel you. So, when you think about how hard this work is, what keeps you going? Like what brings you joy about the work that you do, and what parts of the work at Noora Health really fuel your creativity as leaders?
First. Wow. Well, I think the first part of that is just it's not just the two of us, or even the wider team at Noora Health that's making all of this happen, kind of bringing caregiving to the front and center of the health systems that we're partnering in and working in. It's nurses, government partners, administrators, everyone who's involved in making this happen. And I think, one of the things that drives me, and I know Edith as well, is just the ability to connect with so many different people on this aspect, which is care that we all experience and individually in our own lives. It has been a part of our own personal journeys, and thinking about together how can we bring this into the healthcare system and integrate it. So I think one of the things that drives me is just the relationships that we get to build, and we have the honor and privilege of working with so many incredible people, both within our team and across the ecosystems that we work with.
Yeah, and so much joy in this particular moment. This morning we were discussing our trainings. There's always a moment in the trainings of the nurses or in the trainings with families where you see that spark or that aha moment. And this work at its core is very simple in its essence, right? And for us, I know I always find so much joy in seeing that moment where, in the same spark that we had in our early interviews with patients and families and nurses and caregivers, seeing the agency and the power and that excitement light up. and also feeling very humbled in this moment, surrounded by some of the funders who have been with us from the very beginning, and getting messages and whatnot from partners and everyone across the ecosystem that we have the privilege to work with, and feeling very lucky to be the ones sitting here talking to you. But really, it's the community of 300 plus Norans and over 5,000 nurses and the many government partners and millions of patients and caregivers that this really is about. And that's what wakes me up every morning, and getting to work with this guy.
That's great. Thanks so much. Yeah, I mean, I think we'll have an opportunity to hear from a couple of team members in this session, which is amazing. And you two certainly deserve the spotlight and the recognition yourselves. But at the same time, as you mentioned, so do your government partners, so do the nurses that you work with. And just a one plug for the audience is that we have Dr. Baljit Kaur, one of your government partners, speaking on a panel, I think immediately after this.
Yeah.
Yep.
So there's a good question in the chat, and I think it's maybe a good opportunity to bring in Anand Kumar from your team. There's this human-centered design aspect to your work, and I think that in the healthcare space and in the social innovation space, there can be a lot of kind of obsession with newness and invention, but this was a solution that you all really identified that was hiding in plain sight. And so I would love to hear a little bit about kind of what that realization was like, and how human-centered design played a part in actually developing a solution. And maybe Edith and Shahid, you can introduce Anand to take on that and add on to what he shares.
Sure. Thanks so much, Ben. Absolutely. Human-centered design thinking is core to how we kind of formulated and started this work, and continues to be to this day kind of what guides us in many circumstances. And really it began by listening and observing and being with people within the hospitals and clinics where we initially started our work, and then of course in homes and communities, and recognizing this immense care that was happening every day. It was so powerful and beautiful, and immense, I guess, is the best word for it in my mind right now. And recognizing that there was something here that we could maybe just piece together to make happen. And continually, after even that initial idea, it was about design. It was about going back and listening, and again whenever we would try something new. And one of the most incredible parts of that listening happen with nurses all across the healthcare ecosystem. But one of the first nurses that we got the privilege of meeting now almost a decade ago was Anand Kumar in a hospital in Bangalore. And we were just blown away, of course, by that infectious smile that you see today. But one of the things that we remember, and one of the kind of sights that I have still of Anand now, is of him doing what we are advocating doing across health systems worldwide, but on his own in the wards that he was working in, with videos and tools that he created himself, and gathering families in a similar way to how we envision it. And just, I remember both of us were just blown away by like the simplicity of what was happening, but the beauty and the power in that moment, in such a often sterile and maybe not human environment that a hospital can be. So we saw Anand doing that again about a decade ago, and then kept bugging him as much as we could along the way. And now Anand is our director of training and leads that. And Anand, would love to hear more from you about design and everything that you're doing.
Right. Hi, everyone, and hi, Ben. And many congratulations to Noora team and all the Noorans out here. I'm pretty excited about this whole event. And I would say probably, as Ben rightly put, or Edith also rightly said, it's not just a celebration of healthcare system, but also the human kind around here. Talking about the human-centered designing, probably I was introduced to this by Edith and Shahid formally But otherwise, one thing that when I was doing this health education session back in the hospitals about 8-10 years ago, all we ever wanted was, every patient or family member who comes to the hospital would understand the system, how hospital works, and better cooperate with the healthcare workers or healthcare providers there, so that they get to learn things. Plus, also they go back home with all the information that they needed. That is what was most important for us when we started our program. And later, it's all about revolving, or the whole system revolves around, or putting the patients and family members at the center of the healthcare system, rather than putting them outside. So that is, for me, is the human-centered designing.
And thanks so much, Anand, and congratulations to you on this great achievement and award. And excited for all you'll do beyond this in your role. I'm curious to hear your reflections on really why you made the shift that you did. So you were delivering care, you were a nurse in this system that you're now seeking to shift and change and train others on. Why did you kind of shift your focus to actually, as opposed to just delivering care yourself and working in a hospital, why did you shift your focus to trying to systematize that and train others in this? And for folks that haven't gotten to see it, we got to see Anand's work firsthand, training the trainers, and hearing his amazing voice bellowing through the halls as so many both caregivers and other nurses were learning from his work. So could you share about why you made that call and how that's going?
Sure. Probably if you ask any nurse what is the most satisfying thing in your job, is to see that smile on the face of the patients and family members when they leave the hospital. Probably, for me, I always enjoyed caring for the patients in the hospital, and perhaps every now and then, like the compliments of patients before they leave, hey, thank you for taking care of me. It was something so soothing and very satisfying. But when I started this program back in the private hospital back in 8 years ago or what, I was not just taking care of one person, but when the information is being shared in a group of people, not only for a patient but for the family members, the smile on their face was so encouraging for me, and I was able to feel that they're relieved, or they're satisfied with this information, or they're all of their doubts are clear. So that satisfaction is something that drives me forever. And of course, when Edith and Shahid called me when I was working in a government hospital, that hey, you should join us as a training director, I was more excited than they are. Plus, also, I always felt the care component program is very close to my heart, as I see. And that's why, though I left that bedside work, or probably I still miss a little bit part of that, working in a bedside, taking care of patients. But I still, when I see smile on the patients' family members, it still gives me the satisfaction. That's what drives me.
That's amazing. Thank you, Anand. And just to reflect that, I think so many people have been impacted by the movement and mission, shared mission that you all have with your partners, with the nurses that you work with, and it was a privilege to get to see some of that, and speak with some of those nurses. I wonder if this is a good opportunity to share, maybe related to Anand's work as leading your training and your train the trainers across the government hospitals where you work. Maybe Edith and Shahid, this would be a good opportunity to share kind of how you think about systems change and scaling your work. I think that one of the things that you share in a longer video that will be out on Skoll.org is about how you hand over this model to government, and how this isn't, there's not hundreds and hundreds of Anands that you're employing to deploy this model, but you're working hand in hand with government and with nurses that are already there, and with administrators that are taking this on for themselves and really helping shape it going forward. Could you share a little bit about what that looks like? How do you work with government, and how do you transition to real government leadership and ownership of this program over time.
Yeah. Yeah, when we first were working on this and starting Noora, we had no plans or intentions to start an organization. So from the very beginning, we were using human-centered design principles and design thinking to take a bunch of puzzle pieces and put them together and deliver something for the 1-2 hospitals we worked with in the early days that would continue to run sustainably after we left and went back to our lives. And so that's where I think the very root and the genesis of this started by being very intentional about how can we solve a deep problem for nurses, for patients, for families? How can we create a more holistic and patient-centered and family-centered way of helping people move through this incredibly, emotionally charged, stressful, and scary, very often time. And over time, that has evolved in various ways. And again, another plug for the next session, you'll hear a bit more from Dr. Baljeet Kaur from the state of Punjab government about what this looks like now. But the way that the program is implemented is leveraging and working in partnership with nurses who are already employed by the hospital, working in partnership with families and patients within the hospital to make sure that the content and materials that are being introduced are hyper localized and are in not just the right language, but show visuals from local community. And so all of these things, making nurses and trainers the owners and the innovators within the hospital to shift and change the training on any given day based on what they're seeing in the ward and with the patients that are on the ward. And so from sort of the micro level, that's what that looks like. And then at the macro level, we've been very intentional over time in setting up our relationships with our partners in a way that makes them the owner of the program. It's not the Noora Health program being operated in XYZ health system. It's, you heard Anand say earlier, the Care Companion program. It's an initiative of the state government of blank or the national government of blank. And really, we from the very start, put the ownership in the hands of those partners. And we are there to facilitate and support and introduce, and of course, move alongside over a set number of years. But the idea is to eventually slowly remove ourselves. And as you said, Noora doesn't have trainers in hospitals that are running programs and sessions day to day. We are there to kickstart, we're there to support, but it really is an owned intervention by local governments. Anything to add?
No, that's perfect.
Yeah, that's so helpful. And I want to call back again to the earlier session and thinking about Paul Farmer's work and many others' work in government accompaniment. I always struggle to say that word, accompanying government, and I think that's what you're doing. I would love to take this now take another opportunity to bring in another colleague of yours. I wish we could have all the Noorans here, but we'll bring in one more colleague. That's Dr. Seema Murthy. Hi, Seema. Congratulations. You're on mute.
Hi, Ben. Hi, everyone here. Thanks for calling me. It's an honor to be here.
Thank you for being with us. So Dr. Seema leads the research work at Noora Health. And I think one question that we wanted to share with you and hear your response on, Seema, was, how this all very interesting. It's all it's a very compelling model. It's a very compelling story on human-centered design. But how do you know that all of this work, all this hard work from the team and from these nurses, how do you know that what you're doing is worth it? How do you know that this is having the impact that you really hope to achieve as an organization?
I've worked both as a clinical doctor and as a public health professional in various settings, academic settings, for-profit, not-for-profit, but the last 3 years of my work at Noora has been the most meaningful. There's several reasons. Great organization culture, we're very open to ideas as long as it's serving the single mission, the core mission. But primarily for me, because I'm able to see the impact in numbers in the communities that we serve. Not only in numbers, but many unmeasured aspects of this impact. Say when a patient, I heard somebody say after a session, immediately after a session, she was saying she felt respected for having been given this class. Respect, it took me a while to absorb that, because that was not something I'd expected. And she had so much of gratitude in her eyes. That was because she knew she was getting something much more than what can be expected in a government hospital setting. And maybe because of this, we often hear our nurses tell us that the patient-provider relationship, ever since Noora's program got started, uh, has improved. Patient trust the nurses more. The number of outbursts that happen in the hospital are reducing. In fact, one nurse from Madhya Pradesh shared an event where there was a family member who was upset with her, but the rest of the people in the ward came forward to support her. And she said, this could have never happened if this program was not there. But apart from this, yes, the numbers are very, very important. And we are seeing that difference. You want me to talk more about the numbers?
Yeah, sure. Please share some examples. And thank you so much for the personal reflection as well. It's equally important.
Thank you. I'm very happy on this wonderful platform to share a fact that all of us have been very proud of, that CCP program is showing some promise to make a dent in the neonatal mortality. I'll share a small story behind this. When we started this evaluation, we were not even thinking of measuring mortality. We were in fact trying to see if the initial success that we saw in our initial study, can we replicate it when the program is actually at scale? So several reasons, mortality is a difficult indicator to make a difference in. It's a difficult indicator to measure, especially with a health program like ours, in a very short duration of time. So when we set up the study, it was primarily to look at knowledge decrease, behavior change, knowledge increase, behavior change, and complication reductions and things like that. We didn't even have the capacity at that point of time to do the sensitive interviewing for when a death was reported. So we stopped the interviews when a death was reported. But when we stopped data collection, when COVID started, it was midline, and we had nearly collected 133,000 family details, capturing their entire neonatal period. And it was a very precious data set coming from 28 districts across 4 states in India. This huge data set, we definitely wanted to see the mortality. We gave it to an external partner, and the results came back, my heart leapt up in joy. We were seeing an 18% reduction in neonatal mortality. I agree and accept wholeheartedly that this was not the most robust study design. We could have done better. But nevertheless, the amount of change that we were seeing is very significant. Maybe some people can say, yeah, neonatal mortality is anyway on the reduction across globally. So this may be just a reflection of that. But just to put it in perspective, what India saw between NFHS, that is the National Family Health Survey, the NFHS 4 and 5, over a 5-year period, was 16% reduction. We were seeing a slightly better reduction in a very short span of 1.5 years. And there was no other major program, either health-related or non-health related, that started during this phase. So this is very, very encouraging. Inspires us.
Yeah, of course. Congratulations. Thanks so much for sharing.
Yeah. And we are planning to publish the challenges of this as well as the findings with our partners at our RNA labs. It's still a work in progress.
That's great. Thanks so much, Dr. Murthy. So we have about 5 minutes left, and there's lots of questions in the chat. So I'm imploring Noora folks in the chat to answer some of those. I'll call maybe one quick one to Edith and Shahid related to how this work can expand. And I would love for you to share how you plan to expand this beyond the current geographic footprint, and maybe what you think, countries like the US could learn from what leaders in India are really leading in terms of care companion and caregiver training.
Thanks, Ben, and thank you so much for that question in the comments as well. So I'll answer this maybe in 2 parts. The first being kind of like what is written out and kind of our immediate plan for expansion, but then also, of course, kind of the bigger picture and what we're really trying to get at, which is how can we make this just how the way things are in the healthcare system? How can we make this the standard of care? So for the first part, over the next 6 years, what we're hoping to do is in the 6 states that we currently work in India, and with the government of Bangladesh and in Bangladesh, where we already currently work, continuing to expand the program to additional levels of the health system, and also building out more types of patient condition areas where this is relevant. Right now, we are in neonatal and maternal health, cardiac, oncology, medical, surgical, and tuberculosis care. So continuing to, of course, iterate on those models to make them better, but adding several more patient condition areas to be able to meet the needs of the people who are coming to primarily the public health system, and also redesigning the model so that we are relevant no matter what level of care someone is coming to. And a simple way of putting this is that a hospital looks very different than a clinic, of course, in terms of patient interactions, the types of patients who are coming in, and the time that they're spending, et cetera. So our model needs to shift and change to meet those needs. And so our design team is hard at work in doing that. So in the places that we work, continuing to focus on and refine and expand within those healthcare systems. And as Edith was mentioning, kind of along that journey, continuing to hand over ownership for programs that have been started. So that's built into really how we work. In terms of new geographies, we do intend on adding additional Indian states. Right now, we're targeting about 4, and also 2 additional countries, likely within the region, to really be able to show that this is not something that only works in the handful of places that we started it, but really can be a global movement. And then getting to that point, I think this is where we would love to brainstorm with the community as well. We've seen this work in the places that we're working in. We have an incredible set of partners and ecosystem that we continue to expand in. And as Seema mentioned, evidence that this is making a real impact on health outcomes. Now, how do we take this and piece it together and really be able to work with additional health systems and be able to inspire others to be able to take this up on their own, maybe? And what role can we play, whether it's building a toolkit or working in collaboration with others and setting guidelines to make this happen. So I think that the second phase of that is something, of course, we could speak to at length as well. We have brainstormed a lot about it, but something that we're just really inspired to be able to dive in with the community here.
Yeah, our ultimate dream is for this to live far beyond Noora, and for other health systems, organizations, partners to take this on, make it their own, and bring caregivers into the fold, make them a core part of the healthcare delivery team. And that will look different depending on where in the world it's happening. But that fundamental essence, we hope we can share a little bit of what we've learned with the broader community, and ideally encourage others to make this happen within their health systems.
Thank you so much. We have about 1 minute left, so I'm just going to ask one more quick thing. Is just if I think these past couple of years during the COVID-19 pandemic have really elevated the role of caregivers, and the majority of whom are women, who are really unsung, under-recognized, and even sometimes mistreated in their systems, despite their really heroic efforts to care for their families and their communities. And so I'm wondering if we probably have many of them from all different backgrounds on the call today. So I'm just wondering, do you just have a sentence or two of encouragement or something you'd want to share with all the caregivers out there who are seeing this model and seeing you today?
We see you, we value you, we are here, and we want to help.
Yes, and we don't. I think this honor and recognition is incredible, and we don't take it lightly. And we completely recognize that caregiving, while it's beautiful and powerful, at the same time can be incredibly challenging and bring with it a whole set of issues that we need to address head on. And we look forward to doing that in collaboration with many of you here. And yeah, we don't take that lightly. So thank you, Ben.
Thank you all so much, and thank you for that. And in closing, we just wanted to say a huge congratulations to the entire Noora Health team, Edith, Shahed, Seema, Anand, thanks for being here, and congratulations to you and your team and your government partners, all the way to the nurses and families that you work with and partner with. And thank you for your work.
Thank you.
Maybe audience members, please show your love and support for Noora in the chat as you have been doing.
Big hugs.
Thank you.
Thank you, Noora, and congratulations. So at this point, we're going to transition to speak with MapBiomas. And namely, we have Tasso Azevedo, the general coordinator of the MapBiomas network, here with us today. For anyone that just joined, we just took 30 minutes with Noora Health and their team to learn more deeply about their work, and this will be recorded, as is the award ceremony that we went through about an hour ago. Please take the opportunity to share on social media with the hashtag SkollWF. And please reach out to these awardees, reach out to Noora, the team members you saw in the chat there, reach out to MapBiomas, the team members you're about to hear from, if you have ways to support their work or encouragement for them, or simply celebration and love for them, that would be much appreciated. And lastly, again, audience members, you've been great to share questions that you have in the chat. Please continue to do so as we shift to thinking and talking with MapBiomas. So we're joined today by Tasso from MapBiomas. Welcome, Tasso, and congratulations on the Skoll Award.
Yeah, really proud and humbled. This is like an important way to highlight what has been done by this immense network that is involved in MapBiomas. We are all very happy.
I want to get there. Actually, I want to hear about this network because it's a little bit. Yeah, I think there was maybe one sentence about it in the video, and I think there's much more to learn. And I love your background, by the way. I wish I had. I need to put something like that behind my Zoom space. So yeah, the first question I wanted to share, and others in the chat, please feel free to share more that you have for Tasso and the MapBiomas network. But in the video, you briefly mentioned the MapBiomas as a network. So can you share with the audience what that means? You're the general coordinator of the MapBiomas network, but obviously this is the work of much more than one individual, and even the work of much more than one individual organization or institution. So maybe you could share a little bit about that and a little bit about kind of who else couldn't fit on the Zoom screen or on the platform that you're really representing the work of.
Yeah, so let's say the thing that we were trying to tackle, which is kind of basically describe everything that happens on the land and how we use the land. It makes us to kind of the only way to do it is if you have like the broad range of abilities and knowledge to put together. So we need people that understands about like remote sensing satellites. We need people that understand the subjects that we want to map, like agriculture, pasture land, the biomes, water. There is like 25 different subjects that we are trying to map and understanding what's going on. And also we need people like in computer science that understands about how to create the algorithms and so on. So the idea of this project is like to bring together people with this different backgrounds and expertise, working in different places and regions, first in Brazil and then out there in other countries, to build up this thing from the ground up, because we were building something that didn't exist, really, like this type of mapping. And it's done in a very particular way in which everyone shares every single piece of what they are doing as they are doing. And so that's part of the game. So we have universities, NGOs. We have also some startups, tech startups. They are collaborating to put this up. And so it's funny because there's no like one institution. MapBiomas is not an institution, it's really a network. And so it starts like this in Brazil, and it's the same thing happening in all countries in South America, which has different initiatives working on this. again, with local organizations with different backgrounds working together. And then we have Indonesia, which is also a new experience in the other side of the world, and again with local organizations. But what we have in common is that everybody is really working to with this vision of having a better way to manage our natural resources and manage our land. And so this makes people to map different things. Like if you go to different countries, they will be mapping different things, but these are the things that matters on their reality and their circumstances, and also the way how they use that. So maybe, I mean, if we can bring Chimer, which is in Indonesia.
Yeah, we'd love to bring Timur on stage.
Yeah, because then he can talk a little bit about like the experience of doing this in Indonesia. Like this was the most recent initiative on MapBiomas. It starts just 2 years ago, and it's all done with the leadership of Chima there.
Welcome, Timur, and congratulations on the Skoll Award from the MapBiomas Network. And great to have you here. Thank you for joining so late where you are. I would love to just hear you share where you are, what you're working on right now, and how did you actually reproduce MapBiomas in a network in Indonesia? If you could just share a little bit about your work and the progress that you all have made with local institutions and networks and organizations there, that would be great.
Yeah, thanks Ben, thanks Tasso, and I'm being honored to be here, and it's great. I think it's about MapBiomas. One thing that that we see the advantage is it's embrace localities. Not because if we look at the forest as kind of one definition in the world, but then with MapBiomas we can canvas so many layers, so many class, so many land cover. And in Indonesia, for example, at the moment we have 10 land cover class, and also the amazing things with this MapBiomas is the network itself. So then we can learn from each other. Like so, in Indonesia, we have 3 sessions of skill shares with our Brazilian colleagues, Tasso and friends and colleagues there, and then we develop Indonesia here, combining international, let's say, expertise and our local knowledge. So then, because if compare to Brazil and Indonesia, for example, it's very different comparison, because Brazil is mainland, large land, and Indonesia is island by island. We have 16,000 island in the country, for example, and it's different approach. But then with the network itself, we can now have a collection one that we are already published and in November, and now we are disseminating to island by island, meeting with the government, stakeholders and locals and universities and media, civil society, etc. And yeah, that's we are at the moment.
That's incredible. I called out in the chat you're combining international expertise with our local knowledge. I think that's extremely powerful. Could you share? I think currently you're traveling, right? You're amidst the work right now with governments and sharing the first collection across each of these islands and governments and regions in Indonesia. Is that correct?
Yeah. For example, today I met with the local government in the province of Papua. So we present this and then we explain, and it's quite encouraging their response. Even they ask us to like train them in coming times, so then they can develop quite similar or use this platform in their policy making to protect, let's say, forests in Papua. Or and I think one thing that quite different, quite better in MapBiomas is we see this as tools in development, actually. So not only protecting forests, but also in let's say designing infrastructure, designing development in general. So not only protecting forests, and we get those encouraging response from every place we visit, like in Kalimantan. We meet with the governor's team there, and also so many let's say agriculture, mining bureau, and also media. We also meet similarly in Sulawesi Island, and also in Molucca. So yeah, I think it's I can say this is kind of game changer in development. If we then can uh, in contribute way with the government here. So we are not, the basic thing is we are not competing with other platform, but we are in like how to say it is reciprocal benefiting each other. So that's the beauty of this MapBiomas, I think.
And one thing that is interesting, Ben, this thing is, it's not like that as a network, we are producing a map for everywhere in the world and then have local organizations kind of validating or something like this. The idea here is that it's really built up locally. So people are making maps that matters to whatever they are. And so it's strange sometimes because like you see maps that have different legends and etc. But it's really to be a tool that helps to dialogue and discuss and um, promote the well-informed decisions on how to best manage our the land. So this kind of a spreading up like this.
Yeah, absolutely. And I'm curious, I think it's easy for folks that aren't actively in the space. When you think about land use change, I think people tend to think about kind of just deforestation, just tree cover loss, and also just the Amazon, as opposed to all the other regions that need to be protected and managed. So could you share a little bit more? I mean, you MapBiomas, as you mentioned, depending on the local context and the local need, you're mapping much more than that. Could you share, and you're tracking and trying to influence decisions that of course affect deforestation, but also go far beyond that. Could you tell us why that's important?
Yeah, because I think the whole thing is how the natural system, like and the natural resource that we have are being managed, and things are all interrelated. So we start because we want to understand how land use changing is affecting climate change or being impacted by climate change, and then but by doing so, by creating maps that allow us to understand that, we start to see many different potential applications, right? But let's say, just to clarify, what is one collection? Like I think Timur mentioned that we have a collection. One collection of data is like a collection of maps year by year, showing how the land is on each year on a 30-meter resolution. So every piece of 30 by 30 meters in Brazil, for example, which is 9.6 billion pieces, each one of those pieces, we tell the story over the time. And so once you put together those pieces, you can put together the pieces of one municipality, for example, then you can understand the dynamics of the land use in the municipality. So let's say, for example, that you have an area in a municipality that starts as a forest, but then during this period, it was clear cut and deforested. So what happened afterwards? So part of that, we know by studying this, that part of that, it's becoming pasture land. And this pasture land is degrading over time. Part of that, it turned into agriculture. Part of that, actually, after degrading, is actually now abandoned, is regenerating. So the idea here is to understand all the dynamics and see how can we interfere on those dynamics to help to manage better the land. So for example, a decision maker could say, look, we have this much pasture land, which is degraded now. How about we make policies to improve the use of those lands, which is already with pasture, in order to be more productive, regenerate the soil, etc., instead of going after new pieces of forest? What kind of incentives or sticks we can use here to make this happen. And same thing, for example, happened with gold mining. So we are seeing mining going into indigenous lands in Brazil. This is a tragedy because through the maps we can see the impact of gold mining throughout the region. So that's the reason why we are mapping the whole use of the land, and including other topics like, for example, just understanding all the water, how water is changing in Brazil over the time, or how fire is affecting the different types of land use. And one interesting thing, Ben, we have been researching a lot about how people are using the data, because we create for one specific purpose in the beginning, and then it's starts to spread out. And I think we have a colleague of ours,
Julia. Julia.
Yeah, and Julia is basically surveying all of that, and she's a scientific coordinator of the project, and she's always kind of seeing these different applications. Maybe she can highlight some of the interesting applications that are showing up.
Yeah, and just to crystallize for you too, I mean, and thank you, Julia, for being here, and congratulations to you and your team on this work. I think that it's easy to look at what MapBiomas is doing and see the amazing maps and the amazing collections that are being put together, and in many cases see the really harrowing data about the land use change, about deforestation, about the loss of water in Brazil, all of these things that you're researching. But really what struck the Skoll Foundation when we were looking at MapBiomas was how this was actually driving changing decisions and actual results to shift these systems and increase carbon capture and have many other kind of follow-on impacts. So with that as a preamble, Julia, I would love to hear from you on some of those most impactful results over the last few years, and maybe even some that you didn't fully expect, as Tassa mentioned.
Hi all, and thank you for being here. MapBiomas data is being used on science in many researchers, where we have done a survey having more than 700 scientific papers using MapBiomas data, involving a diverse of applications that we even thought about it. But MapBiomas is also being used directly to decision-making that Ben comment. And for example, a very interesting case in health is that the one with yellow fever disease, where monitoring dead monkeys that are the hosts of yellow fever in the forest areas mapped by MapBiomas, Fiocruz Institute developed a system of yellow fever risk, and with that, they plan vaccination to people. So that's a quite unusual one. Ben is still thinking about how to relate all with that, but we have also a video on YouTube, a documentary that tells this story about the yellow fever and the use of MapBiomas in the risk of this disease. In the financial sector, we have another example, like agriculture in Brazil is heavily financed by banks. Banks such as Banco do Brasil, the biggest bank of rural credit in the country, are using MapBiomas alerts to not give credit with illegal deforestation and to guarantee that they are not financing deforestation in those areas. And another critical example that Tas also mentioned, but I'm going to detail a little bit more, is that in the last year in Brazil, we passed through a water crisis. The Brazilian Water Agency, ANA, used MapBiomas data to analyze the impact of land use change on water availability in the watersheds. And where MapBiomas data also revealed that Brazil is drastically losing water surface over the last years. So for us, as the MapBiomas network, is not just to have the data, tools, and technology available, but the most important thing is that those data and maps are being used by people and institutions to make effective changes.
Yeah. I think this one on water is interesting, Ben. We were just looking to that yesterday because today there is a very important vote happening on judgment actually happening on the Supreme Court in Brazil about the various attacks to the environmental regulation legislation in the country. And so we were discussing some of the elements that will go there, and we come up across with this data that was recently publishing, showing that in the amount of rain that we have in Brazil over the last 25 years. And what we see is that consistently on the last 15 years, we have monthly by monthly, 90% of them are raining less than the average. So it's kind of a going down and down and down the amount of rain. And if you cross with this, with the information we map on the water surface of Brazil, it shows consistently the water surface in Brazil going down. Like we lose 15% of our water surface in the last 20 years, which was something that we never realized, because every time we see like data on water, we say like water is going up and down every year. So you basically don't see the whole thing over the period of time. And so you just have an idea of the critical things of this. When we map the water bodies in the border of the Amazon and Cerrado, where you have like the deforestation frontier, we find out over 50,000 artificial reservoirs, which are basically people, as the weather gets dry because they are cutting the forest, then they are building up those reservoirs to the farms and so on. And over 60% of those were never registered. So the water agencies didn't know that this exists. And so you can't regulate to guarantee that the water is used for the the common use. So these are the types of things that are coming out when you really understand what's going on in the way of the land use and cover.
That's great. Thanks so much, Tasso and Julia. I'm curious for you, Timur, because you're earlier in this work. So in Indonesia, you're launching the first collection. You're, as you mentioned, you're really you're doing the groundwork right now. What kind of decisions do you think that the data that you're creating and the work that the network is doing in Indonesia, what kind of decisions do you hope to impact to shift things in the ecosystem there? You're still on mute.
Sorry. Yeah, we have so many examples already that this data already inspiring the local government and the government here. Like when we met with the governor's team in Sulawesi, when we saw the expansion of year by year of post-mining area, meaning mining hole in the region, and then suddenly they said, why then we still have in this kind of poor area, kind of showing that, meaning that although we have expansion of mining whole area, but the prosperity is not increased. Then they suddenly say that, and then is using this data to discuss with other with the bureau there, and quite similarly also when we saw in Papua the expansion of palm oil, the expansion of palm oil in the island, the same expression also come, and then we discuss how to manage to prevent those kind of loss in the country. So and in the country like Indonesia is developing countries, sometimes they see and they excuse deforestation for development. They say we need deforestation to develop, but when we saw like year by year deforestation, and then we at the same time the prosperity or the not increase, then something wrong in our development. So then that's why we see this as a tools for development planning, not only for deforestation prevention, but also, for example, when we saw the map of infrastructure or like new road, and then potential deforestation as we saw already year by year before, and then the government then we expect to find a better way to mitigate this kind of loss. So so we let's say we canvas MapBiomas actually in Indonesia as a tool in development planning, not only just to prevent deforestation.
That's great, Timur. Thank you so much. And I'm sure there's going to be a lot more that you find that this can impact over time, as they have found in Brazil. So I want to pull a question from the audience in the comments. For you, Tasso, there's a lot of questions and a lot of people were expressing interest to expand this to other geographies, and to actually try to take action on this themselves and work with the MapBiomas network. Could you share kind of where are you all right now geographically, and how might others, where are you looking? Where is the MapBiomas network likely to expand to, and what does that look like for getting involved for folks in the land use space?
Yeah, so we are in all countries in South America, although in Guyana, French Guyana, English Guyana, and Suriname, we still don't have a specific local organization there, and then we are eager to find out a specific organization. So we have been collaborating with organizations that work in more than one country, but yeah, eager to collaborate with anyone in these regions. We are Indonesia, as we said, and we really would like to be in to bring this set of tools to Africa also. So we have been finding contacts first with DRC. There is a specific reason for that. Like, it's the second largest tropical forest in the world. This whole Congo basin is extremely important, and it's where we have the second highest also deforestation after Brazil. So yeah, so that's a place where we want to go. But I mean, for MapBiomas to work, what we really need to find is local partners that are fit to first work in group, like in collaboration, and embrace that. Second, that are committed with science-based work. It doesn't matter if you really knows about mapping, but you are committed with that. And also, it's a local organization that wants to dig into do the whole thing. So it's not like we're not hire anyone to do the work, but transmit that. So yeah, so we are focusing more on those three regions, but this can be applied anywhere. Like, I see that there is a comment here in US. Sure, I mean, obviously it can be done in US, Europe, anywhere. It's just like, and it's all open source, like everything from ground up, all the source codes, everything is on GitHub and etc. So anyone can use.
Yeah, and one of the rules actually of being a part of MapBiomas is that once you create the data and the code, that you have to publish. You have to put it on the online and make it open source, as opposed to holding on to it or hoarding it for your own research purposes or publication.
Actually, anyone can use to do whatever they want, including for commercial purpose. It's all open. The difference is if you want to be part of the network itself, which is then collaborating as you do the work and etc., then this is the rule. The rule is everything should be open, and as soon as you have the data, also release the data, so the community can, work on that and build up on applications on that.
Thank you, Tasso. And so one more thing to emphasize, and then one last question for you, is that MapBiomas is not only made up of the network that is building these tools and maps, but also that its network is taking action on them through advocacy, through partnerships with banks, all of those things that were mentioned in the ceremony. So last question before we close, Tasso, what is these are big issues that you're working on. It's hard to know how to plug in as individuals. What's your call to action for the audience? How do we grow this from?
Yeah, I think this is like, I said this on the video, and I truly believe on that. That's the thing. The thing for all of us is just to move things forward. Like, and that's actually the theme of the conference. And so I say, on everything we do, we have to look at the stage where we are, what we receive, and just give it back or transfer to someone else better than what you receive as a principle. And I think this is what I expect when people see what we are showing up. So we are showing up, for example, a level of deforestation that is unacceptable in Brazil, both in primary vegetation, but also in secondary vegetation. And so anyone can actually do one step. So if you are a bank, you don't want to relate it to them. If you are in any way related to the chain of custody of those products, you can act upon that on your use your purchasing powers and so on. But in a very, and also support the ones that better protect the forest. And in the case of Brazil, it's easily the indigenous people. These are the people that best protect the forest. So any support you give to them, you are actually giving support to better manage the land. So just some examples of what we can do.
That's great. Thanks so much, Tasso. I have to close us. I wish I had a couple more hours with both Noora and MapBiomas. But in closing, huge congratulations to the entire MapBiomas team and network, the network of over 200 people working around the world on this movement. Thank you for what you're doing. Audience members, please show your love and support for MapBiomas in the chat, and get in touch with them this week during the Skoll World Forum if you have ways to support their work. Thank you, MapBiomas and Noora, and congratulations, and we'll see you out there.